Hello and welcome to my YouTube channel. I am Dr. Smita Pattanayak from Dental Sage, Yelahanka, Newtown. And after a long time, I'll be speaking about a very important topic which is known as mouth ulcers. So basically mouth ulcers happen on a regular basis for many of the patients and many of us. They are commonly known as canker sores also. So what makes or what results in a mouth ulcers? Let's first know about that. So there are certain food which can cause mouth ulcers, like citric food or acidic food, which can result in a development of a mouth ulcer inside your oral cavity. So what are these fruits or food habit? They are anything in acidic medium, like acidic beverage or most of the citrus fruits. You can eat them because they are good in one way, but there are limitations. There are certain limitations which you should mark so that you don't supersede the amount or quantity you are eating if you are prone to ulcers. There are certain physical issues in an individual which may also result in ulcers, like if a person is having diabetes, and that too uncontrolled diabetes, definitely yes, you may result in lots of mouth ulcers within your oral cavity. There are certain things like GERD, which is gastroesophageal reflux disorder. In such patients also, many a times because of the reflux regurgitation, patients have mouth ulcerations and they complain of it more often. There are certain kinds of deficiency, like deficiency of B12, vitamin D, in cases of which there are ulcerations which can grow in your oral cavity. Another important factor which can result in mouth ulceration is stress. Yes, stress plays a very important role in maintaining not only your mental health, but also it affects the overall regular systems of your body, which includes your oral cavity. So many of the patients or individuals undergo mouth ulcerations because of stress. So how do we actually decrease the rate of mouth ulceration in our oral cavity? We can decrease the intake of acidic food, like acidic beverages, soft drinks which has acidic medium. We can decrease the intake of citrus fruits. We should get ourselves tested for any kind of deficiency in the blood, and thus if we find out that there is a deficiency, we should report it to the general medicine or to the dentist, and they'll help you out. Besides that, we should, if you have seen that the sores are just erupting and it is not painful, and you do not go with the over-the-counter drug, you can start gargling or rinsing with salt water. That will decrease the intensity of pain or the number of more eruptions. So these are the few factors which you can actually consider if you see a lot of mouth ulceration within your oral cavity. But it is always necessary that you should get a guidance. So in such cases, if you are getting a repeated mouth ulceration, I would suggest please report to your dentist, or in other cases, if you are not willing to go to a dentist, please show it to a general medicine practitioner. And for any other queries related to how the mouth ulcers can be treated or how it can be decreased in its number, please log into our website, that is www.dentalsage.co.in, and I am Dr. Smita Pattanayak signing off for now. Thank you.